So although we've known HPV as the leading cause of cervical cancer for many years, it's been an exciting breakthrough that we've now discovered it's also a major contributor to oral cancer. HPV is a virus. There's many different strains of HPV, but it's a virus that can infect tissues upon contact, so most commonly spread by intimate contact such as intercourse or oral sex. We do have a vaccine for HPV. In fact, we have 2 different vaccines made by 2 separate manufacturers, both of which are approved currently in the United States for young girls and women between 12 and 26 years old. Those vaccines are not FDA approved for prevention or treatment of oral cancer. They're currently approved for prevention and treatment, not really treatment, but for prevention of cervical cancer. One of them also covers prevention of genital warts at this time. Whether or not they're going to provide coverage of the strains that are associated with causing oral cancer, we don't know yet. Those studies aren't out yet. I'm not aware of this studies that are underway at the moment to investigate that, but it's not something we're going to have an answer to in the next 6 months or year, most likely. Every vaccine carries some side effects. In general, in order for a vaccine to get approved by the FDA, the side effects are very minimal. Personally, I've never had a patient have any side effect other than just a little bit of soreness at the delivery site, which is typically the arm. They are considered to be extremely safe and to have a great long-term benefit and impact on the individual, and then that extrapolates to a benefit for most of the society. I think there's a lot of confusion about the HPV vaccine, and many parents are concerned that if they provide their child with an HPV vaccine, that will then be a ticket for freedom, high-risk sexual behavior, or perhaps might encourage them to engage in sexual activity that they otherwise would not have. There's really good research data that is not true. Girls, and probably boys, although we know more about girls, to be honest, don't base their choices about sexual behavior on whether or not they've had a vaccine to prevent an outcome 30 years from now, meaning prevention of cervical cancer. So I really try to encourage my parents to treat this vaccine just like they do other vaccines, that this is something we're doing now for long-term prevention, and it shouldn't alter your day-to-day behavior. So the current HPV vaccine, the most common one that's used, is only approved up until the age of 26, and that's really only because that is the age bracket which the company chose to study. It would have been overwhelming to study the entire population, so you have to define the high-risk age groups, and between 12 and 26 are the years when most people do the most partner changing or have the highest rate of exposure from sexual activity to HPV. It doesn't mean it doesn't work if you're older than 26, it just means it hasn't been approved for that age group because it wasn't studied. If you're above the age of 26 and you would like to have the HPV vaccine, you need to discuss it with your physician. Many of us will provide it as an off-label use, meaning that you have to recognize the FDA did not study it in your age group, and there's a good chance that your insurance may not pay for it, but many physicians provide it off-label for people over 26 and for boys. Many boys are getting HPV vaccines and have been before it got FDA approved for boys as well. I think we need to stay tuned to the upcoming research that's going to come out and help us understand better the association between HPV and oral cancer and how that relates to oral sex. I think we need to be thinking more about how to prevent transmission of pathogens during oral sex and really talk to our patients more about what their sexual practices are so we can make sure we provide them with the best counseling.